This video shows the technique for repairing a split earlobe. First, a zigzag pattern is marked on the patient's ear using a surgical marker. A zigzag pattern is used because scars tend to contract as they heal. A straight line closure will contract more than a zigzag pattern, and this may lead to a notch at the inferior portion of the earlobe. In order to minimize the risk of notching, the zigzag pattern is used. The zigzag can be designed with the convex surface facing either the anterior or posterior portion of the earlobe. Next, the skin is prepped with alcohol, and a local anesthetic containing epinephrine is injected into the earlobe. The local anesthetic minimizes pain and discomfort during the procedure, while the epinephrine causes vasoconstriction, which minimizes bleeding. With the use of the local anesthetic, this procedure is performed quickly and comfortably in the office. Next, a tongue depressor is placed behind the earlobe and downward traction is used to tighten the skin so that the marked area can be excised sharply with a knife. The purpose of this excision is to remove the tissue at the edges of the split earlobe. This will expose healthy, bleeding tissue, which should heal very well after surgery. This is an important step in the surgery, as simply sewing together the edges of the split earlobe without excising the tissue would not heal. This can be done with either a scalpel or scissors, depending on surgeon preference. I prefer to begin the cut using the scalpel and then use the scissors to finish the excision. Once the excision is complete, there is a defect in the earlobe in the shape of the zigzag pattern that has been created. You can see how this fits together seamlessly. Next, repair of the split earlobe is begun. Suturing of the earlobe should begin at the lateral edge of the lobule. This is the most important point that needs to be lined up properly in order to minimize earlobe notching. I use a 5/0 purling for this suture and place interrupted bites along the anterior surface of the earlobe. Multiple suture bites are needed to close the earlobe, and these are easily removed in the office 7 to 10 days after the procedure is complete. Patients typically recover very well after surgery. There is usually very little pain, and once the sutures are removed in 1 to 2 weeks, the patients can resume their normal activities. In general, re-piercing of the ears is delayed until approximately 3 months after surgery. There are no restrictions on re-piercing, but it is advisable that the new earring hole should not be placed along the same line of scar, as this can lead to earring pull-through and recurrence of the split.